Welcome to this explainer. Today, we're diving into something really fascinating: how biological aging isn't some sort of failure, but rather a reality we can intelligently design around. We're going to look at this incredible intersection of human biology, cutting-edge AI, and interior design. Because, we actually have the power to transform our living spaces from potential hazard zones into seamless extensions of proactive healthcare.
So, let's kick things off with a pretty staggering statistic. Gerontology experts have found that in a single year, up to 67% of people over the age of 65 experience a fall at home. 67%. That is a huge number. And this isn't just a simple stumble either. It's a major health crisis that leads to long hospital stays, heavy economic loss, and a really severe drop in morale. In fact, this issue is so critical that Europe actually established a whole initiative, the Prevention of Falls Network Europe, or Profane, specifically to combat it. But to stop these falls, we first need to understand the biological mechanics of why they happen in the first place.
To do that, we've got a clear roadmap for today's explainer. We're going to cover 1. The reality of aging joints, 2. Detecting knee osteoarthritis, 3. Osteoporosis and changing height, and 4. Actionable ergonomic home modifications.
All right, jumping right into Section 1, the reality of aging joints, with a focus on flexibility and motor skills.
Let's look at things at the microscopic level. There is a really stark contrast between normal joint flexibility and the physical realities of an aging joint. You see, as we get older, we naturally lose elasticity in our muscles and tissues. Simple things, reaching up, bending down, twisting, they become inherently more difficult. Thanks to joint pain, weakness, and sometimes tremors, our complex motor skills just start to degrade. But here is the most fascinating and frankly dangerous part. Doing 2 actions at once, like trying to push a door while simultaneously turning the handle or gripping a stiff appliance knob? For someone with severe joint degradation, that dual motion becomes almost literally impossible. So, moving from general joint issues, let's head to Section 2, detecting knee osteoarthritis. Medical science actually breaks down the progression of knee osteoarthritis into 5 distinct stages, known as the Kellgren-Lawrence or KL stages. We have normal, suspicious, mild, moderate, and severe. Now, the trick with osteoarthritis is that if you can catch it in those early suspicious or mild stages, you can intervene. With physical therapy and specific exercises, you can slow the disease down and drastically improve a person's quality of life. The problem, though, has always been trying to catch it accurately and early enough just by looking at standard X-rays.
Enter modern tech. A brand new AI model called DenseNet 201 can now detect these 5 stages from X-rays with a massive 85% accuracy. That's a total game changer. By using advanced image filtering to clear up the visual noise, this hybrid AI just leaps past previous models that were stuck hovering around 67 to 83%. What does this mean for us? Earlier detection, timely physical therapy, and ultimately, far fewer falls. Which brings us to Section 3, osteoporosis and changing height. Because, well, it isn't just our joints acting up, our entire bone structure is changing too. Because osteoporosis literally shrinks our overall height, our homes actually become mismatched to our bodies over time. Think about standard kitchen counters. They're typically 90 centimeters high, but as an elderly person's height decreases, that 90-centimeter counter suddenly becomes dangerously high and unergonomic. To adapt to this, guidelines now dictate that we absolutely must design secondary surfaces in the kitchen at 75 to 80 centimeters. This little adjustment allows the resident to safely prep food or eat while comfortably seated, completely removing the strain on their back and the risk of losing their balance.
And this specific kitchen modification is especially vital because data shows women experience significantly more home falls than men. Why is that? Well, historically and practically, they just spend a lot more time in these very spaces, like the kitchen, moving around and maintaining the home despite their advancing age. So, modifying the counter isn't some luxury upgrade. It's a targeted, empathetic safety intervention for a really vulnerable group.
Let's zoom out to the macro level now with Section 4, ergonomic home modifications, where we treat the entire home environment as an extension of healthcare.
This universal accessibility icon right here, this represents our ultimate goal: homes that adapt to our changing bodies rather than fighting them. We want to create spaces where an elderly person doesn't have to navigate an obstacle course of uneven floor thresholds or worry about not having crucial grab bars just to make a cup of tea. So let's look at exactly how we redesign these spaces.
Starting at the entrance, the first thing we do is focus on threshold removal to eliminate those immediate tripping hazards.
Then, for mobility loss, we naturally think about replacing stairs with ramps. When calculating ramp slopes, the grade has to be incredibly gentle, around an 8 to 12% grade depending on the height, with flat resting spaces at both ends. But actually, here's a really fascinating twist. While wheelchair users and people with walkers absolutely need these ramps, individuals suffering specifically from rheumatism actually prefer properly designed stairs. Turns out, the constant angle of a ramp can cause them significantly more joint pain.
So for those who prefer or need to use stairs, we have to engineer them perfectly. We're talking a maximum height of 15 centimeters and a minimum depth of 30 centimeters. This highly specific geometry minimizes joint strain when lifting the leg. Plus, the front edge of every single step must feature a 2.5 centimeter non-slip strip in a contrasting color just to help out aging eyes. And crucially, these ergonomic stairs have to be paired with sturdy grab bars on both sides for maximum stability. Moving inside the living room, we find a hidden enemy: chic, modern, low furniture. It looks great, sure, but low, unstable furniture is a massive hazard. As mobility decreases, older adults rely heavily on holding, leaning, and pulling themselves up against furniture, essentially transferring their entire body weight onto it. If a chair is too low, getting up puts immense, painful strain on those aging knees. If a side table is lightweight, it'll tip right over the second they lean on it, causing a severe fall. The fix? Furniture must be elevated, sturdy, and ergonomically designed to support pushing and pulling. Finally, let's head into the bedroom. This is a place of rest, but it requires very precise modifications. First off, the bed needs to be exactly 45 to 50 centimeters high. This specific height allows for easy, level transfers for wheelchair users. Second, for those who are bedridden or struggle to sit up, strong support suspenders should be mounted directly to the ceiling right above the bed. And third, and I found this psychological insight truly surprising, freestanding mirrors should actually be removed from the bedroom entirely, or at least placed inside closet doors. As cognitive functions change and vision blurs, catching an unexpected reflection at night can cause severe disorientation and panic, which often leads to hasty movements and, you guessed it, falls.
So, we've seen how aging structurally changes our joints, how AI is stepping up to help us detect these changes earlier, and how precise ergonomic design, from threshold removal to grab bars, can counteract our physical limitations. I want to leave you with this final, vital takeaway to chew on today. If our biology is constantly adapting as we age, shouldn't our homes adapt with us? Thanks so much for joining me on this explainer, and I really hope this changes the way you look at the spaces you live in every single day.